Thanks, Catherine, and thanks to NIHCM for including me on this webinar today. In the short time that I have, I'm going to go through some very recent trends in health benefits and then basically set the stage for some more detailed information that Howard and William are going to provide in terms of what we may see down in the future for employment-based health benefits. When you take a look at the slide, and hopefully everyone on the webinar has seen some version of this in the past, it's one of the main drivers of what employers have been, why they've been changing their health benefits. Even though premiums have been increasing at single-digit rates since about 2004, they're still outpacing inflation and worker earnings increases at about twice the rate. So it's something that employers, despite the single-digit increases, are heavily focused on. It's one of the reasons why you see fewer workers with health benefits. You can see that since 2000, the percentage of workers with employment-based coverage, either from their own job or through another family member, has been falling. It was as high as almost 76% back in 2000 and down to just over 68% in 2011. And the black line below that shows the percentage of workers that are uninsured, and you can see it basically bottomed out at around 15% back in 2000 and is over 19% now. So you've got those trends happening, and you somewhat attribute those trends to the prior slide on increasing costs, but there are other factors involved that you should be aware of. One being we're already seeing an increase in the percentage of workers employed on a part-time basis. That's that green line in the center of the chart. You can see it basically bounced around between 16 and 17% for almost 10 years, and starting in 2008 began to increase, and between 2007 and 2011 went from 17 to 22%. There's lots of concern that employers are going to cut people's hours as a result of the Affordable Care Act and the mandate requiring that workers working 30 more hours be provided coverage, but this is a trend that's already been happening independent of the ACA. And another reason why we've seen the percentage of workers with employment-based coverage drop has to do with structural change in the economy, where there are just fewer manufacturing jobs, and manufacturing jobs have always been more likely than just about every other industry, I think the exception being the public sector, to provide health benefits. So simply shifting workers to part-time and simply shifting workers from manufacturing to other jobs will reduce the number of workers with employment-based coverage. We haven't seen since over the better part of almost the last 10 years, we haven't seen fewer employers offering health benefits. For the most part, it's been bouncing around 60% since 2005, with the exception of 2010, which I'm not sure I believe that increase in 2010 and then subsequent decrease. But it is expected to decline. The Congressional Budget Office is predicting that come 2019, there will be 20 million fewer people covered by employment-based coverage. This is just one scenario, and I certainly encourage you to check out the source. There's a link at the bottom of the slide. I know the slides will be made available after the call, but you could. This is part of a larger report where the CBO models out various scenarios and presents 4 of the scenarios they modeled out. And in all fairness, I'm picking the worst scenario here, where they show the 20 million fewer people with employment-based coverage. They do have one scenario of the 4 where they show more people with employment-based coverage come 2019. But the expectation for the most part is that there'll be fewer people with it. Some recent trends in what benefits have looked like. We've been seeing increases in cost sharing across the board. This slide shows you the average deductibles for employee-only coverage and a PPO by firm size, and you can see that the average deductible in smaller firms is over $1,200. Again, employee-only coverage, not family coverage. Family coverage deductible is much higher. Larger firms, the average deductible is up to $563. And keep in mind, this is PPO coverage. Does not include consumer-driven health plans. Does not include HSAs, for example. which are known as high deductible health plans. So even outside of the high deductible health plan space, you see deductibles over $1,000 already in the small group market. Cost sharing to see your doctor has been going up. The percentage of workers with coverage that are paying between $20 and $30 to see their primary care physician has gone from 42% to 58% over the course of only about 6 years, and the percentage with a $30 copay has gone from 8% to 19%. There's a similar slide I don't have here showing the same trend for specialist office visits. You see co-payments going up for prescription drugs, especially for the non-preferred drugs, though even the preferred drugs, you see them going up. For generics, they're basically staying the same. And you're also seeing a movement to coinsurance when it comes to prescription drugs. And you can see how few people have co-payments at this point, and how many are up to, with coinsurance, up to 75% as of last year. And there's been this trend to consumer-driven health plans. It started in 2001 with health reimbursement arrangements. HSAs came along in 2004. There's not good data before 2006 because for the most part there were so few people in these plans, but a decade later, a decade after they were introduced, there's 19% of the working population, at least as of last year, probably more this year, enrolled in some type of consumer-driven health plan. You could argue that that's both it's a small number given the potential to be much higher, but it's also a relatively large number given that a decade ago it was in large part zero. There's also a movement to something called value-based insurance design, which some of you may have heard of. The basic premise is to align out-of-pocket costs with the value of health services. So higher value health services would have lower out-of-pocket costs associated with them. And as of 2 years ago, 23% of employers reported offering some type of VBID approach, but over half are considering introducing it over the next 3 to 5 years. So that's something to look out for. The Affordable Care Act completely changes the playing field moving forward, and this is something that's got employers' attention. Workers don't have to worry about their pre-existing conditions anymore. There's limited age rating. If you're below 400% of poverty, you get a subsidy. It basically wipes out age rating because your premium is capped at a percentage of your income, and you can see what those ranges are here. There's theoretically more choice of health plan, and we'll see how much choice it really is. We're starting to see the states announce how much, the choices. Standardized choices may make it easier for people to pick a plan, and essential health benefits may make it easier for people to pick a plan. And employers, there are some at least thinking that maybe I don't need to offer health benefits anymore because my employees can get it on their own. The initial reaction, I think, though, was when the Affordable Care Act was passed, some employers said, I could get out of this and it's only going to cost me $2,000. But reality set in right away. Reality being that employers have already been voluntarily offering these benefits in the absence of a mandate since as far back as World War II. And they've been doing so to be competitive in the labor market. They're concerned about recruitment and retention. They're concerned about the health status of their workers, especially as it relates to productivity. And none of those concerns have abated. Employers are still concerned to this day. And even when we had 10% unemployment back in 2010, you didn't see employers abandoning health benefits. There were still some employers that were concerned about recruitment and retention, and they were always concerned about the health status of their workers and how it affects productivity. There's a fear that if employers drop coverage, they would the $2,000 penalty would increase. They haven't seen the public exchanges yet, so they're lacking some confidence. And they can't simply go to the exchanges until at least 2017. So while the initial reaction was to drop coverage, and then reality set in that it's not so easy, this whole concept of private exchanges, which you may have started hearing about because it's gotten a whole lot more attention, may become the middle ground between the status quo and employers completely dropping coverage. But it's hard to ignore a chart like this, and I'm always skeptical about surveys of employers to get their opinion as to what they're going to do in the future. This is a survey done almost every year back to 2003. by the National Business Group on Health and Towers Watson, where they ask employers about their confidence that they will be offering health benefits a decade from now. And you can see what's happened to employer confidence. It's eroded. It's gone from 70% 2007 down to the low to mid-20s just in the last couple of years. And I think really what this represents is that employers, they just don't know. They can't say for sure that they'll still be offering health benefits a decade from now. But they just don't know. They're sort of stuck in limbo until next year. The public exchanges aren't up and running just yet. The private exchanges are in development, and they're basically taking a wait-and-see approach. But there's a lot of skepticism, and there's also a lot of interest in moving to some type of defined contribution strategy. Employers have been interested in the concept of defined contribution health benefits for over a decade. According to this survey of human resource officers at mostly Fortune 500 companies just 2 years ago, 36% said that they were giving serious consideration to moving to a defined contribution strategy over the next 10 years. They never moved in this direction because they, for the most part, couldn't. There was no viable alternative to employment-based coverage where they could give workers money to go buy insurance. So instead, they gave workers money to go buy health care through health reimbursement arrangements and then health savings accounts. But now that the playing field has changed, this whole idea of defined contribution health is returning, and private exchanges may actually be the vehicle to allow it to happen. But I think what's really important is the dynamics. The fact that, I like to joke around and say employers generally don't want to be first, but they don't want to be third. There's a follow the leader or Me Too effect that you see playing out, and just because you won't see a lot of employers in private exchanges next year doesn't mean you won't see a lot of them in private exchanges, say 10 or even 20 years from now. And these are some of the surveys that try and get at employer behavior and how it's influenced by what other employers are doing. I already mentioned this whole concept of defined contribution health is not new. Some would say that it's really the 21st century version of what a cafeteria plan was envisioned 30 years ago. But the Affordable Care gave it some renewed interest, and you had to work it out. And Enthoven did around managed competition many years ago. You had reports come out not just from EBRI on private exchanges last summer, but from the ERISA Industry Committee and the Committee for Economic Development back in 2007, before the presidential election that brought us the Affordable Care Act, where those two organizations basically put out reports on their vision for health reform, which included, they didn't call it private exchange, at least I don't think they did, but it included that vision of some type of exchange combined with a defined contribution or some type of contribution. What is a private exchange? And the other speakers are going to get into this in more detail, so I don't want to spend a whole lot of time on it, but it's basically a private business that sells insurance products to consumers through some type of web-based portal, and it's typically operated by insurance brokers, benefit consultants, or insurance companies. They offer the use of defined contribution health plans. They don't have to. They expand employee choice. They provide decision support to help people make decisions about their health benefits, and they provide end-to-end transactional services in terms of how, basically turnkey services to help employers and employees alike. They can be single carrier exchanges or multi-carrier exchanges. They could be single employer exchanges or multi-employer exchanges, and they could also provide other benefits such as dental, vision, and voluntary benefits that you may not think about too often, like life, short-term and long-term disability, and even things like legal benefits and pet insurance, and there are others to go along with that as well. It's a pretty crowded field, and I don't think that this slide even does it justice, but just to give you a sense of some of the names out there, it reminds me of of the years leading up to 2001 when we had health reimbursement arrangements. And for those of you that were, studying health benefits back then, you may remember companies like Definity Health and Luminos that eventually got acquired, and some others that went out of business that aren't around anymore. And we'll see, which of these on the slide, and I think there's another slide from one of the other speakers that has others listed as well. We'll see who will be around and who gets acquired and who basically is able to maintain the business model that they develop. How fast will a movement to private exchanges happen? I'll go out on a limb and basically say that it's tough to say. I've seen estimates that as much as 10% of the employment-based market will be in a private exchange come 2020. The best I could do is tell you how fast other trends and benefits happened. For example, the movement to defined contribution retirement plans, which is what's shown in the slide. It's the red line, played out over the better part of 30 years. It took from 1979 to 2010 to go from 15% of workers with a defined contribution plan only to 70%. Didn't happen overnight. Similarly, with retiree health benefits, the percentage of employers offering those benefits has been falling. It was as high as, for employers with 500 or more workers, as high as 46% back in 1993, and it took the better part of 20 years to get down to 24%. So again, it didn't happen overnight, but it happened. And you saw this slide already, the movement to consumer-driven health plans. After a decade, we're only at 19%. So maybe after 10 years from now, we'll be at 20% of workers in some type of private exchange. But it's a really tough number to project, given that there aren't that many out there live, and employers have a lot of interest, but most don't want to be first. And employers do, even though I said before, most don't want to be first or third. It takes quite a while for employers to follow the lead of when there's a herd mentality. So I think that's the end of my slides, and I look forward to the Q&A.